Before you set up your tray table, make sure you wash your hands with antibacterial soap for a minimum of 20 seconds. For added protection, you can also wear gloves when you're setting up your tray table. A good way to ensure you don't cross-contaminate your tray table is to apply a plastic sheet over the top and the sides for extra protection. Then you want to apply paper. You can use your bed paper for this. Then apply a non-permeable bib on top of the paper, shiny side down, to maximize absorption. Now you're ready to put all the supplies you will need for your procedure. You can start out with a couple of pieces of barrier tape, sticky side down, for your cream topicals and ointments and your wipes. Then you want to barrier tape anything you will be touching, such as your machine. You want to apply a piece of barrier tape over the controls. Even though your machine will be under your tray table, you may need to touch it to change your speed. Apply plastic core tubing to your handpiece, at least 1 yard. Lay it on top of a small piece of barrier tape that you will use to cover the seam between your handpiece and your needle. This allows you to change to different needles during the procedure, and you don't have to unwrap the whole handpiece. Place your package needle on the tray table. Remember to show your client when they enter the room the package needle before you open it. This will ensure your client that you always use new and sterile needles. You will also barrier tape your lamp, the handle on your bed that brings your client up and down. If you use an electro spa bed, you would barrier tape the remote control. You will barrier tape your magnifier handles and also your headlamp if you use them. Also barrier tape your hand mirror and the handle on your chair stool. You will want to put a pill cup with a little green soap and pure water for dipping your Q-tips to use as erasers when you draw. Put a little Vaseline under the cup to prevent knocking it over. Use a large pigment cup for your liquid topical anesthetic. Again, put a little Vaseline to prevent knocking it over. On your barrier tape here, you can put a dollop of Vaseline and a small amount of your cream anesthetic that you will use during your procedure. On this barrier tape here, you can put your wipes to keep them from drying out. Place a handful of Q-tips and a couple of toothpicks. You will use the toothpicks to draw with once you break the skin, because you can't use your pencil, and also to mix your pigment if you don't have a mixer. Place a couple of micro brushes, a pair of gloves, and an additional pair of gloves, a couple of tissues, and your mask. I use about 5 cotton balls to put my sweetheart ring, and I use Vaseline in one of the slots and put my pigment cup in there so it doesn't fall out during the procedure. Everyone works a little bit differently. One thing we want to make clear is to make sure there is nothing on the tray table that you don't want thrown away. No pigment bottles, no topical bottles, no tweezers, etc. When you start your procedure and break skin, you must deglove if you're going to touch anything that does not have barrier tape. Once you break skin, do not touch your tray table without gloves. If you need to leave the room for any reason during the procedure, make sure you take off your gloves, your mask, and your gown and throw them in the trash at the door before you leave the room. If you wear magnifiers, take off the barrier and wash them in the sink. Wrap them in Sani-Wipes. When you come back, put on a new gown, new mask, and new gloves. Apply new barrier tape on your magnifiers. This is how we set up our tray table.